Good morning, friends. Today we are discussing regarding the school health services and the community health nurse. The community health nurse play a vital role in the school health service program. School health service, it is very important because we know very well this is the important branch of the community health nurse, community health, and according to the modern concept regarding the school health services, it is economically or economically or physically it is powerful. It means raising the community health, and it is more powerful, important to future generation. The school health service, it is a personal health services. We know very well in previously, before 10 to 20 years ago, the school health service is not working properly, and we also know that 1 by 4th of the population, country population, is a school age children. These children are future of our country, and the total morbidity and mortality rate of the children are depend on that school health, because more than times the students are spent in their schools. So it is very important concept that how the medical examination is done by the health personals, school personals, and it is a broad concept for health and well-being for the children throughout the school. So school health, if we can discuss regarding the school health, first of all we can explain regarding the health. What is the health? So already we know, so many times we defined that the health is a state of physical, mental, social and spiritual well-being, and not merely absence of disease or infirmity. Means a person who are free from all types of the problems. It means he is totally healthy, physically healthy, mentally healthy, socially healthy, and spiritually healthy. Yes, he does not have any type of the disability in our body, and any type of the confusion in our mind, and he is free from problems. So health is very important. And now we are discussing regarding the school health. School health means the environment of the schools where the children are studying, and they are spent their times in that campus or institutions. So that institution is properly maintained according to the environmental sanitations, according to the physical sanitations, physical infrastructures, and ventilations, and their nutritional programs, and all these other things. So if the institution is healthy, their workers also healthy, and the school personals also healthy, and they have the knowledge regarding how to maintain the health and how to provide the service to the children and how to assess the health of the children, then the students get good health, and they can live with a physically healthy life. So these are the school health, and this is school health service have the different types, you know very well. Ideally, school health service rendered to the pupil, teachers, and other personnel in the school. The main aim to promote the health and to prevent and control the disease and maintain their health also. So school health service are an important dimension of the community health. Some of the reasons why we know and why how to say that a school health is very important in a to the healthy community. So according to that, it is divided in some points. You can see one by one. First is the large number. So you know very well that one fourth of the our population is going to school. So 5 to 14 years of the age childs majorly spend their time in the school period. So it is large in numbers. They are staying in the schools in 6 to 7 hours, and how they get the benefits of these health services, and how they are spend their time with with a suitable environment or unsuitable environment. So all these things come under that. So large number of the population is children. Second one, period of growth and development. We know very well this 5 to 14 years of age school going children have um, the growth time, the period of the growth, body growth, physically growth in that years. So they are totally physically, mentally, or spiritually, or socially, or emotionally changes in this time period. So they need very well the supervision and guidance they need that times. So that is the period of the growth and development. Group living. Group living means this is the first experience of the children that they are living outside the home with other persons, and how they get the friendships, how they live together, how they behave each others, and how they survive their times in the schools. So group peoples, they are making the groups, they are making the friend circles, and they provide opportunity of health supervision and guidance by the school persons. So it is very important in the group, the major chances to spread the infections in the groups. So how the how the school members, school personnel can prevent their problems, and how to promote their health, and how to educate the children, then they can live healthy lives. So next one is the control population. Controlled population. It means controlled population means a school going children are they are spend their times in the school period, and they are divided in the different types of the groups, means in classes, division in the classrooms, the first class, second class, third class, fourth class, and all the classes undercome a supervisor. It means a class teacher, it means a principals, it means administrative officers. So they are controlled because they are giving the some of education regarding the health, regarding the environment, regarding the life, and regarding their changes. So these types of the functions and these types of the information if students are following, and they follow in their homes also. So these are the controlled population, means they follow the rules and regulations, they follow the principles, they follow the ideas of our teachers or our health personnel. So these are the controlled population. And last and most important, that the educational opportunity. The school is the best form for the imparting, the providing health education and molding the attitude and practice of the children. So this is the some of the steps for the school going children and school services. What is the aims and what is the objective of school health services? So mainly, you know very well that main aim is promotion of the health, prevention prevention of the diseases and rehabilitation, and improve the nutritional programs. So these are the main aims and some of the objects. How to prevent and control the communicable disease. So to prevent and communicable disease is more important. To promote the growth and development of the school children, to promote the healthy school living, so a school child may develop favorable attitude toward the health, and create health consciousness among the school children and their parents and teachers, And next one objective is create health, imparting health information and conducting health education in various aspects to helpful living, the school, the home, and in the community. Next one, identify and treat any abnormality, any defect, or any disease as early as possible, and it is necessary to referral and follow up these types of the services. And in this, involve the teachers, students, and their parents in maximum of health aspects of children and provision of the healthful environment. Some of the important principles for this community health service program. So, principles of the health services, school health services are based on the health need of the school children. The main principles, these school health services is based on health need of the school children, and we planned and coordinate with the school head personnel and parents and community people also. Next one, we part of the community health service, and it emphasizes on promotive and preventive aspects, and it emphasizes on the health education, promote, protect, and improve and maintain the health of the children and the staff also. And most important principles is ongoing and continuous programs is there, and it have an effective system of record keeping and reporting the health assessment, the health indicators of the children. What type of the health services provided by the community health nurse? So it is most important functions of a community health nurse. Which type of the functions we follow? So first of all, community health nurse have the most important role to health appraisal, means how to diagnose, means how to assess the health problems of a child. So before reaching the health medical officers, she ensure, it means the community health nurse ensure the health record all properly filled in. She can understand preliminary health checkups. It include the measurement, height, weight, and mid-arm circumference and arm circumference, and identify all types of the risk of the children's, and she can done all these examination with the help of a medical officers. So community health nurse follow the checklist. These are the, she can check the students, children's unusually flushed face, any rashes or spots, symptoms of any acute cold, coughing or sneezing, any sore throat, any rigid neck, any red or watery eyes, any type of the headache, any type of shivering, fever, restlessness, disillusionedness, means lack of energy to play, means lethargy, any type of children is suffering from the diarrhea, pain in anywhere in the body, any rashes on the skins, any scabbage, ringworm, any type of the headache, head lice. So she is taking the full assessment of head to foot of the children. The major steps by the community health nurse. Second one is the treatment and follow-up. After getting the assessment from by the community health nurse to the children's, school-going children's, the very well after inspection, if she get any type of the disability or any detected children's disease or disability, she is provided with the help of the medical officers the appropriate treatment or follow-up cares. She send the students to the clinics, nowadays each hospitals, each schools, the institutions have their own clinics because it is very useful for the students or children who are getting the accidents, so they can provide the first aid type of the treatments of the child. If the children is suffering with the major problems, they will refer to the students or children to the hospitals. So that is the most important. Third one, the community health nurse play a major role in the immunization process because uh, more than part of the population who need the immunity power in our body for their growth and development, for the fight of the disease or for fight the disabilities. The immunization is very important part. So this immunization is successfully complete in in the institutions because more than children are spend their time in the schools. So a well-planned immunization program should be completed by the community health nurse against the common diseases, common communicable diseases, and this immunization process is very well recorded, and they follow this immunization process, and they teach the students or they teach the family members regarding that immunization process, how it is important to the children for their growth and development. Next, most important functions for a community health nurse is social sanitization. Social sanitization means provide a model, a good sanitation surrounding the schools. It means all these facilities are available in the schools regarding that, for examples, that safe drinking water facility. It means provide the well water, safe water, pure water facility by the tube well or anywhere, and provide the proper urinals as per the study that 60 students per 60 students per urinal, and sanitary latrine for 100 students, like this they arrange in the schools, and these types of the facilities are arranged separate for the boys and girls also, and the healthful school environment is necessary for improvement or for growth and development of the children or pupils. Next functions like the nutritional services. It is also very important because more than school children is come from the slum areas or rural areas. They have the lack of knowledge regarding the nutritional diet, and their growth and development are also affected by these problems. So nutritional service is very important. For this, government can promote the midday meal programs in the schools. Means all type of the nutrition services provide to the children in the school time by the Anganwadis, and vitamin A prophylaxis because vitamin is very important for their eyes and their sights for. So every up to 6 year of the child can take vitamin A orally every 6 months of durations. And next, most important functions of a community health net provide the first aid care to the children's, care to the school age people. So she prepared and she have the a proper kit of the first aid. So any emergency, commonly in the schools, she can take the service. And the first aid is very useful in the injury when the children are playing in the ground, when the children are running in the schools, and when children are sometimes of the because of the fight, they can harm each other. So this first aid is very important to stop the any bleeding or any other problems. So first aid is very important for that functions of a community health nurse. And next one is the health education. It is also a very important part because a community health nurse has the proper knowledge regarding that growth and development of the children, growth and development of a baby, and their nutritional diet, and regarding the first aid care, and regarding the follow-up cares. So she can teach, or she can take the class of their parents, and how to give the nutritional diet to their children, and how can grow their physically or mentally or spiritually uh, health of the babies. So community health nurse have the major part, major role in the health education. Means when if the baby is suffering from any type of the communicable disease or any common problems, so immunization process is very important. If the baby is suffering with any type of the home injury, how to treat with the first aid. So these type, all types of the important functions provided by the community health nurse. And last, for the service, school health service, the school health record is very important. So community health nurse maintain the records because of for the referral, because of for the review, because of for the follow-up cares. So first of all, she is have a register regarding the full biodata of students and their past history and their physical examination and screening record and any service provided record. So these all records are very helpful for the children for their growth and development. For the school health service, some of the important components. Which one? The most important components means preventive, promotive, and curative and rehabilitative services. How to provide. So health, promotive, and protective service, first type of the component. In this, wholesome of the school environment, maintain of the personal hygiene, and all these things come under that.